You finish, you stand up, and 30 seconds later, that pressure is back. If you're over 60, this is not your imagination, it's not your prostate alone. And the 60-second fix I'll show you tonight, most doctors never mention it. Stay with me. I'm Dr. Adriana Wells. I've been a urologist for over 20 years, and the message I get most weeks from people your age sounds almost word for word the same. Doc, I just went. Why does it feel like I have to go again? Right now, you're sitting there wondering if this is the start of something bad. A tumor, a blocked kidney, something that takes your independence away. I want you to take a breath. Because in most cases, and I mean most, what you're feeling has a name, a mechanism, and a fix you can start tonight. But here's where it gets frustrating. You went to your doctor. You got 15 minutes. They ordered a urine test, maybe a PSA. They said drink less water before bed and sent you home. And you're still standing in your bathroom at 2 a.m. feeling like a balloon that won't fully deflate. That's not your fault. And it's not their fault either. A 15-minute slot cannot teach you what I'm about to teach you in the next 24 minutes. Before we go further, drop your age and the state you're watching from in the comments. I read every single one, and I plan my next videos around the people who show up. So tell me, are you 63 in Florida, 71 in Michigan, 68 in Texas? Tell me. I'll see you down there. Here's something I rarely admit on camera. For the first 10 years of my career, I told patients your age the same thing every other urologist told them. It's your prostate. We'll watch it. And I missed something big, something that turned out to be the real problem in maybe half of these cases. I'll get to what I missed in just a few minutes. Let me show you what's actually happening inside your body. And I'm going to keep this kitchen table simple. Your bladder is a muscle. Think of it like a small balloon made of muscle. When it fills up, stretch receptors fire and tell your brain, time to go. When you sit down to urinate, that muscle, the detrusor muscle, squeezes the balloon empty. Meanwhile, a different muscle, your sphincter, relaxes and opens the door. Picture a hand squeezing a water balloon over a sink. Strong squeeze, quick relax. That's a bladder at 30. Now picture the same hand at 65. The grip is softer, slower. It still squeezes, but it tires partway through. The balloon empties most of the way, but not all of it. What's left behind is called post-void residual, and here's the part that connects every dot. A healthy bladder leaves behind less than 50 milliliters after you pee, about 3 tablespoons. After 60, it's common to see 100, 150, even 200 milliliters left behind. That's over half a cup of urine your bladder never released. That leftover urine is what's pressing against your bladder wall 30 seconds after you stand up. It's not your imagination, it's volume, real volume, sitting there. Now here's where I went wrong for years. I assumed in men, this was always the prostate squeezing the urethra shut. In women, I assumed it was a pelvic floor issue. Turns out, in both men and women over 60, the bigger driver is often the detrusor muscle itself losing power and timing. It's called detrusor underactivity, and nobody talks about it because there's no pill to sell for it. So when I said in the opening that this isn't your prostate alone, this is what I meant. Even in men with a perfectly normal prostate exam, the bladder muscle itself can be the problem. And in women who don't even have a prostate, this exact same retention shows up for the exact same reason. Let me tell you about a patient. I'll call her Eleanor. 68 years old. Recently retired librarian from a small town outside Cleveland. She came to me with what she called the haunting. Her words. She'd go to the bathroom, walk back to her recliner, and within a minute, that pressure was back. She started carrying spare underwear in her purse. She stopped meeting her grandkids at the park. She told me, eyes wet, Dr. Wells, I'm 68 and I'm planning my life around bathrooms. Her primary care doctor had run a urine culture. Negative. A pelvic exam. Normal. They told her it was just aging. She believed them for 2 years. When I did a bladder scan in my office, non-invasive, just an ultrasound on the belly, Eleanor had 180 milliliters of residual urine sitting in her bladder right after she'd just emptied it. And I want to pause here. Because if you're feeling what Eleanor felt, that haunting, I need you to know something. There are real, evidence-based techniques that helped Eleanor cut that number in half within 3 weeks. No surgery, No new medication. I cover techniques like this every Tuesday on this channel. I've spent 20 years as a urologist, and what I cover here is the stuff that won't fit into your 15-minute doctor visit. If you're over 60 and you want a urologist in your corner every week, hit subscribe. Quietly, no pressure, just so you don't lose this channel. Then come back. We have work to do. Now let me give you the 60-second fix, the one I promised in the opening, the one most doctors don't teach because it takes 10 minutes to explain and they have 8 more patients waiting. It's called the forward lean double void. And there's a reason it works at your age that doesn't apply at 30. I'll walk you through every step. Then I'll tell you the one mistake that makes it worse, the mistake I see patients make every single week. Step 1. Sit down to urinate. I want to say that again. Sit. Even if you're a man. Even if you've stood at the toilet your entire life. After 60, sitting changes the angle of your urethra and relaxes the pelvic floor in a way standing simply can't match. Studies on men with enlarged prostates have shown sitting reduces residual volume meaningfully, just by sitting. If you're already sitting, perfect. Stay with me. Step 2. Lean forward, hands on your knees, or forearms on your thighs. Tilt your chest toward the floor about 30 degrees, like you're tying a shoe but without the bend. This position uses gravity to help your bladder dump downward. It also gently stretches your detrusor muscle into a more favorable contraction angle. Picture pouring the last of the milk out of the carton. You don't hold it straight up. You tilt it. Same principle. Step 3. Empty completely. Then don't stand. This is where almost everyone fails. They feel the stream stop. They stand. They flush. They walk out. Don't. Stay seated. Count to 30 in your head. Slow count. 1 Mississippi, 2 Mississippi. During those 30 seconds, your detrusor muscle is recovering. It just contracted. It's tired. Like any muscle after a set, it needs a beat to reset before it can fire again. This is the 60-second fix. The whole thing takes about a minute from sit to second void. Step 4. Lean forward again, and void a second time. You will be shocked the first time you do this, truly. Most of my patients, and I mean most, will produce another 50 to 100 milliliters of urine on that second void. Urine they did not know was there. That is urine that 15 minutes ago would have been pressing against your bladder wall and tricking your brain into thinking you needed to go again. And the second void, that's where the magic happens. But the first time you try it, do not do the one thing that ruins everything. I'll get to that mistake in just a minute. Now I want to layer in something most videos won't tell you. This technique works better when you combine it with 3 small habits. Habit 1. Hydrate front-loaded. Drink most of your water before 4 p.m. Not by cutting back at night, by drinking more in the morning and early afternoon. Dehydration concentrates urine, which irritates the bladder lining and tricks it into firing the urgency signal earlier. Counterintuitive, but real. Habit 2. Caffeine cutoff at noon. Coffee, tea, and cola contain compounds that act like a small whip on your detrusor muscle. They make it spasm. Spasms feel like urgency, but don't produce volume. After 60, your detrusor is already tired. The last thing it needs is a whip. Habit 3. Pelvic floor squeeze and release. Most people over 60 are told to do Kegels. Squeeze, squeeze, squeeze. Here's what they're not told. In older adults, the bigger problem is often the inability to fully release the pelvic floor. A clenched pelvic floor blocks the bladder from emptying, so for every squeeze you do, count of 3, I want you to do a full, conscious release for a count of 6. Twice as long releasing as squeezing. That's the real exercise after 60. Now, before we go further, I want to be crystal clear about this. Everything I'm telling you is information to bring to your doctor, not to replace them. Here's a script you can use. Word for word. Print it. Bring it. Doctor, I've been feeling incomplete emptying. I'd like to ask 3 things. 1. Can we do a bladder scan to measure my post-void residual? 2. Could any of my current medications be contributing? 3. Am I a candidate for pelvic floor physical therapy? That last one. Pelvic floor physical therapy. after 60, for both men and women. It is one of the most underused tools in medicine, and your insurance likely covers it. Most patients don't know it exists. Now I need to talk about when this is not just a normal age-related issue. When it's something you need to call your doctor about tonight, not next week. Red flag 1, blood in your urine, even once. Pink, red, brown, rust-colored. Call tomorrow morning. Red flag 2, you haven't urinated in over 8 hours despite drinking fluids. That's urinary retention. That's an ER visit. Red flag 3, sudden severe pain in your lower abdomen with the inability to void. ER. Tonight. Red flag 4, fever above 101 with any bladder symptoms. Could be an ascending infection. Same day. Red flag 5, new back pain in the flank area with bladder changes. Could be kidney involvement. Same day. These are not panic buttons. These are clarity buttons. If you have none of these, you are dealing with the manageable, mechanical issue we've been talking about. If you have any of these, pause this video, call your doctor. I want to hear from you right now. Type 1 in the comments if your main issue is feeling incomplete after you go. Type 2 if it's waking up multiple times at night. Type 3 if it's urgency, that sudden have-to-go-now feeling. Type 4 if it's a weak stream that takes forever. I read every comment, and I make my next video based on which number gets the most replies. So tell me, 1, 2, 3, or 4. Now, the mistake. The one I promised you. The mistake that makes everything worse. It's straining, bearing down, pushing. When you can't fully empty, the natural reaction is to push. Hold your breath, squeeze your abdomen, force it out. This is the worst thing you can do. Here's why. When you strain, you're contracting your abdominal wall, which compresses the bladder from outside, but you're also contracting your pelvic floor, which closes the urethra. You're squeezing toothpaste with the cap still on. Worse, chronic straining causes pelvic organ prolapse in women and worsens hemorrhoids and hernias in men. I've seen patients develop bladder prolapse from years of straining to empty. So if nothing comes on the second void after 30 seconds of waiting, stand up, walk away, come back in 15 minutes. The bladder will reset on its own. Do not push. Let me tell you about Robert, 72, retired electrician from Pennsylvania. Came in convinced he needed prostate surgery. His PSA was fine, his prostate was only mildly enlarged, but his post-void residual was 220 milliliters. I taught him the same protocol I just taught you. Forward lean, double void, 30-second wait, front-loaded hydration, caffeine cutoff at noon, pelvic floor release work. 6 weeks later, Robert came back. Residual 90 milliliters. Not perfect, but cut by more than half. He told me he'd slept through the night for the first time in 2 years. He cried. A 72-year-old electrician cried in my office because he got his nights back. No surgery, no new medication, 60 seconds of technique, 3 habits, and the courage to ask his doctor for a bladder scan. So what do you do tonight? Tomorrow? This week? Tonight? Try the forward lean double void at your bedtime bathroom trip. Just once. Notice what comes on the second void. Most of you will be surprised. Tomorrow, cut caffeine off at noon. Drink an extra glass of water in the morning. Notice how your afternoon urgency changes. This week, call your doctor's office. Schedule an appointment. Bring the 3 questions I gave you. Ask about a bladder scan. Ask about pelvic floor PT. Within 30 days, track your nighttime trips on a piece of paper by your bed. Tally marks. Just a count. You will see a pattern emerge that no app can replace. Between you and me, most of my patients see meaningful change within 3 weeks of doing this consistently. Not perfect, but meaningful. Enough to sleep. Enough to leave the house without anxiety. Enough to feel like themselves again. And this is why your doctor didn't tell you. Not because they don't care. They have 8 patients waiting, billing codes to enter, and a system that pays them to refer, not to teach. That's not a conspiracy. That's American healthcare in 2026. You are not abandoned. You just need to advocate. And for the first 10 years of my career, I was one of those doctors who said watch and wait without teaching the technique. I'm not proud of that. But I learned, and now I teach it on every channel I can. So here's where we land tonight. That pressure 30 seconds after you stand up, it's real, it's mechanical, and it has a fix. The fix is 60 seconds long. Forward lean, double void, 30-second pause. Tomorrow you'll cut caffeine at noon. This week you'll call your doctor with 3 specific questions. You are not declining, you are adjusting. Drop one word in the comments below. Just one. The word is ready. That word tells me you're committing to trying this tonight. Then hit subscribe, because next Tuesday I'm releasing a video on the 3 medications after 60 that secretly destroy bladder control. You do not want to miss it. I'll see you there. Medical disclaimer: this video is educational only. It is not a substitute for personalized medical advice. Always consult your physician before making changes to your care. Privacy disclaimer: all patient stories are composites. No identifying details are real. AI disclosure: portions of this script were drafted with AI assistance and reviewed by the host. I'm Dr. Adriana Wells. Take care of yourself tonight.